There are new calls for an inquiry into private health insurance, with economists from the Grattan Institute saying the sector is decades overdue for an overhaul.
Christy Coulter joins us live now from our Sydney newsroom. Christy, why is an independent review wanted?
Well, Laura, this new report by the Grattan Institute has labelled Australia's health system as an unhappy muddle. The Institute's Director of Health says that confusion between governments and health ministers over whether private health insurance is a substitute for the public health sector or whether it is complemented by the public health system has led to confused policy and made it unclear whether having private health insurance is actually of any value. More than half of all Australians currently have private health insurance, which covers things that Medicare doesn't, like dental and optical and allied health services like physiotherapy and chiropractic. But as health insurance premiums rise faster than wages, more and more people are opting out. The Institute is warning the sector could be at risk of a death spiral if the number of young, healthy Australians dropping out of private health insurance continues at the rate that it is. The new report has strengthened calls for a productivity commission inquiry, but the Federal Health Minister, Greg Hunt, says the government is already delivering the most significant reforms to private health insurance in over a decade. He says that work is already commenced with the healthcare sector to identify and implement the next wave of positive reforms to private healthcare to make sure it's affordable and valuable for consumers.